Hello, my name is Fatima Wilder. I'm a thoracic surgeon working at Brigham and Women's Hospital in Boston, Massachusetts, as well as the West Roxbury Veterans Administration Hospital. Screening for lung cancer for Black Americans is very important for several reasons. One of those is that lung cancer affects Black American men specifically more frequently and differently than their white counterparts. For Black men in the United States, lung cancer is the leading cause of death from cancer. And for Black women, it's the second leading cause of death related to cancer. There are more Black men in the United States that die from lung cancer each year than any other group. And when you look at Black women, more Black women die from lung cancer than Asian and Pacific Islander or Hispanic and Latina women. When you compare white Americans and Black Americans, in Black Americans, lung cancer is more commonly diagnosed at a young age. Lung cancer is less likely to be diagnosed at an early stage, at which point the cancer would be more easily treatable. Lung cancer patients that are Black American are less likely to have surgery at an early stage, again, when the cancer would be treatable. And actually, they're more likely to not receive any treatment at all for their lung cancer because their cancer is usually diagnosed at a later stage. And when you look at survival, Black patients or Black Americans are less likely to survive up to 5 years as compared to their white counterparts. This is really important because in the earliest stages, lung cancer is very treatable and curable potentially if you catch it at the right stage. However, this isn't always possible because patients are not always symptomatic and usually are not symptomatic in the earliest stages. So if patients are getting screened, there's a real possibility that we can identify their cancer early on when we can intervene and potentially provide them a cure. There has been work done to prove this, and there is a large study, actually several large studies at this point, that have shown that screening can benefit in terms of lives saved and decreasing mortality or death from lung cancer. And specifically in the largest study, Black participants who were screened had a lower risk of dying from lung cancer as compared to their white counterparts. So overall, the risk of lung cancer being higher in Black Americans can be decreased if we can get that population to be screened for lung cancer early on.